The unwillingness of the Alberta Health Services Board to reconsider its decision on at-risk pay is completely out of step with the government's priorities, and more importantly, the priorities of Albertans.
I can only read between the lines of the directive, but they clearly were not pleased that we approved the pay at risk last week, even though they've known about pay at risk since it was publicly made available back in February.
Earlier this morning, I informed the Alberta Health Services Board Chair and the members of the AHS Board that I am terminating their appointments effective immediately.
And I know Albertans really feel strongly about the sanctity of contract, and it's hard for me to think that anyone would not want us to abide by the sanctity of our contracts.
I will further direct the Administrator to review the decision made by the Alberta Health Services Board yesterday to award bonuses for 2012-13. We don't think it's fair that these bonuses are payable, and our position is very clear, and that's why we've acted today.
Well, I'm still here today, so obviously I haven't seen anything that's troubling enough for me to resign. It's up to the minister to ask for my resignation if he doesn't like what's occurred today.
When we see discussions and when we see responses like the response to my request yesterday that aren't consistent with looking after people and looking after staff, we have a problem and we have to take action, and that's what we did.
On Wednesday, Stephen Lockwood told the Herald, quote, "I don't regret anything I've done, notwithstanding the result that occurred. I did what I think was the right thing to do for the long-term best interest of the system." End of quote.
This is not about reinventing the entire healthcare system. This is about correcting a situation that had become, frankly, intolerable for the government. We've taken that step and we recognize it's a big step, but we're going to keep things stable. Like I said before, this is something that, you know, most people who work at AHS or receive healthcare, this sort of issue is really, you know, invisible to them. It is really not connected with the excellent care that they receive.